Hi, I am Dr. Krishan Vedanayagam from Teaching Hospital, Bagunda. We are seeing what are the causes of testicular pain. We are looking for that. So last time I explained what are the causes for the testicular pain. Today we are going to see a peculiar event. So some people, when they are having this masturbation, they get this sexual arousal. So their penis get erected and they will get this orgasm. But at that time, they never ejaculate. Without ejaculation, they just stop their sexual activity. So it's like that happening when the males are having sex with their wives or with their girlfriends. Same thing happens. What will happen when they sleep together and having a sex and there is an erection, there is a vaginal intercourse happening. When the time of getting the ejaculation, there is some sort of argument between themselves. So due to that, immediately from that point, the male will remove himself from the female. What will happen is he gets the sexual arousal, there is a definite good erection of the penis, but there is orgasm also. He gets to the peakest happiness, but there is no ejaculation. So at this point, after this point, they will get some sort of mild tenderness or mild pain or mild heaviness or mild discomfort over their testes. So there is a good name for this, that is called the blue ball syndrome. So then they go with their girlfriend or then they go with their wife, they have a sex, nice erection, but they won't ejaculate. Immediately they will get the pain over their testicles or inside the scrotum. So what is the mechanism of this? So as a medical term, we are telling this blue ball syndrome is epididymal hypertension. There is a pressure building up inside the testicles. Why that pressure is building up? When, as I told several programs before, when there is an erection, there is an increased blood flow to the testicles as well as to the penis. When the increased blood flow comes, in the testes, there is a tubes are there that called the seminiferous tubules. The seminiferous tubules are dilated to accommodate the increased blood flow. So after the dilatation, there is a definite erection and there is an ejaculation. After the ejaculation, seminiferous tubules are come and goes down and constrict and come to the normal level. But when there is an erection, when there is no ejaculation, the seminiferous tubules which are dilated earlier won't constrict. So due to the dilatation of the seminiferous tubules, there is a pain inside the scrotum or there is a pain in the testes. So what the name called what is this name called blue ball syndrome? Due to the increased blood flow to the testes, there is increased blood flow, so there the testes or the scrotum looks like blue, slight blue color. But you can't see in us. Asian people you can't see because we are blacks. So black people you can't see the blue tinge of the scrotum. But white people, nicely you can see the bluish color over the scrotum. So due to that, what is called is a blue ball syndrome. So that's the thing, the name of the blue ball syndrome. So every time, so from this thing, we can get one thing. When we go to the bedroom, don't take your laptop, don't take your pads, don't take anything. So you always go, don't take your phones also. You always go with your wife or your girlfriend without any disturbance. You have to have a nice sexual affair with your girlfriend or wife. Unless there are terrible interruption of your sexual activity. Due to that, you get the erection, but there is no ejaculation. After that, you will get this blue ball syndrome. So, and I used to tell to my patient that when you are going to the bedroom, put everything out. Remove your old brain, go with fresh brain or new brain, because problems everywhere, problem, business problem, school problem, when you are working, office problem, other problem, and family problems, mother-in-law problem, father-in-law problem, cousins problem. If with all the problem, if you go inside the bedroom, you won't get a proper erection. Even with the proper erection, you won't get the ejaculation. After that, your sexual life gets spoiled. So you must be very careful. Don't get your life spoiled. Always be happy, and with that you must have a good sexual relationship. So what are the symptoms? What will happen in the blue ball syndrome? As I told you earlier, there is a dull aching or heaviness in one or both testicles. There is a pain, dull pain, or there is heaviness of this both testicles. Second one is the testicle, there is a mild testicular swallowing. There is a swollen, testicle slightly swollen. Third is, what are the symptoms of third one is, there is a discomfort in your tummy or lower abdomen or in the groin region. There is some discomfort you will get over the groin or in the abdomen. Next one, as I told you earlier, there is a temporary bluish tinge, bluish discoloration over your scrotum. Normally we can see in the white people. So this, how long this pain will last? This blue ball syndrome pain over the testes will last for minutes, few minutes to some hours. So it will take some hours. Sometime it will take some hours. But as I told you earlier, if there is a testicular pain comes, you must be very careful, because there are a lot of things I told you earlier. There are some infection over the testes, or there is a torsion of the testes, or there is a hernia, there is a hydrocele, as there are some infections, sexually transmitted disease, as well as there is a cancer or tumor also might happen. So don't take a testicular pain is a normal, or don't take it as easy. So from this we can finish this. So what will I do? And help me to, if the people are not seeing this, to introduce to them. If you are watching in the YouTube, please like it, share it and subscribe it. Please follow us in the TikTok, follow me. So have a blessed day.